Welcome to the International Dental Care Clinic at Mangalore. Here you get your dream smile. State-of-the-art dental specialty clinic and dental cosmetic center with direct digital radiography is situated at 3rd floor Mangalore Gate. The super specialty clinic has 7 dental units, including a minor operation theatre. This clinic offers the highest quality of dental care as leading cosmetic dentist, including general dentistry and a broad range of dental services, and dental care for you to help make you smile the best it can be.
Smile designing or smile makeover. This is something regarding the smile. Smile which either whether you are flashing it or whether you are making the smile greater value for someone. This can be done. We have in aesthetic dentistry and cosmetic dentistry, we have the advantage of asking the patient what type of smile they require or whose smile they want to, and we can make over the smile within a day or within a week, depending on what treatment option they take. Either it is a bleaching or veneers, that can be composite or ceramic veneers. Smile designing and a smile makeover is something which increases the smile value, increases the self-confidence and the allure of a patient. So it is an individual, teeth is considered as a personality of an individual. So the loss of tooth decreases the personality and the self-confidence in an individual. So in aesthetic dentistry and cosmetic dentistry, we have the capacity to improve the smile value and the advantage of increasing the self-confidence of an individual.
You will experience the highest quality dental care in a clean, comfortable, friendly environment at the dental specialty clinic, highly suitable for NRIs on their homestay period. Also for other nationals connected with their tourist visit to Mangalore, Kerala and Goa. Mangalore will function as the hub of your South India visit. Will beach tourism, pilgrim tourism, etc., cultural tourism or even short stay education programs shall be clubbed with your dental care in India.
Bleaching of teeth includes a chairside procedure or a home bleaching technique, and a chairside procedure we can improve the color of a tooth within a few minutes, and in a home bleaching technique it is an advantage when the patient wants to make it a little more lighter on a particular day. Whenever they have an occasion, they have an advantage of making it lighter at home. So a combination of a chairside and a home bleach technique can also be used. So bleaching is permanent for at least 5 years, depending upon what is the food habits the patient has. We also improve the smile value by adding on tooth jewelry. Tooth jewelry are of different types. They are basically crystals. They are not real diamonds, they are crystals. The crystals can be diamond, yellow diamond, we have the sapphire and we have the gold, or we have the different alphabets also. In India, most of the time the tooth jewelry are the gender based, whereas in the advanced countries all of them use tooth jewelry. Tooth jewelry is put on a lateral incisor, that is the second tooth in the smile, in the arch, so that it is visualized or it is seen or it is sparkling only when somebody sparkles his smile, when the smile is being shown to others. So it is not seen every time he talks, it is only when the patient smiles. So it improves the value of the smile.
Dental specialty clinic follows infection control protocol as per American Association standardization. Well-trained skilled dental assistants will give you excellent service. Materials used in clinic are CE marked materials. Smile designing, also known as cosmetic smile lift. At Dental Specialty, Center helps you to attain the the most beautiful natural looking smile. The aim of cosmetic dentistry is enhancing your appearance, restoring your self-confidence, increasing your charm. A smile designing or makeover is also known as cosmetic smile lift. It is easy, painless and can change your entire appearance overnight. You will gain a more youthful look and smile at Dental Specialty Clinic that will surprise your friends and relatives.
What you see here is a cosmetic dentistry clinic. The advantage here is what we have to have is all blue and grey colors, and we should not have any walls in the 6 feet. If you notice, you can see blue and grey color wherever we see, either on the roof or on the walls or on the chair. This blue grey color is supposed to be an ideal for any cosmetic dentistry treatment. That is basically to take care of the shade selection and the margin precision. So this clinic has been designed taking the consideration of cosmetic and aesthetic dentistry. So as soon as we see the blue or the grey color, the cones in the retina of the doctor's eye comes back to a rest state, so that we can do a perfect selection of shade and the perfect margins. And here what we see is the cosmetic clinic, and we also have the adjacent. What we have is a clinic where we do endodontic treatment. Endodontic treatment is also called as root canal treatment by a layman. A root canal treatment is something which is used to conserve the tooth at any stage and rehabilitate it to back to form and function. So endodontic treatment is a scientific terminology that it deals with the nerve of the pulp. So at whatever stage the damage has occurred, we have the capacity to regenerate it back and rehabilitate the tooth back to form and function. Along with that, we have another specialty of treatment called periodontics, that is they are dealing with the gums. The most important thing here in a tooth is the foundation, that is the gums. The gums form the foundation for the teeth, and with a healthy gum is a sign of a healthy oral hygiene. If a patient complains of bleeding during brushing, or a patient complains of any bad oral odor, it's basically because there is some problem in the oral cavity. First thing what we have to do is get the oral hygiene back to normal by what we call it as oral prophylaxis, but in a layman's term we call it as cleaning. That is the first stage of any treatment procedure, and after cleaning, and if there is any other procedure to relieve the pain of the patient, and then we go ahead with any advanced treatment like cosmetic dentistry, aesthetic dentistry or implantology. And implantology is another field of dentistry where we have a capacity to rehabilitate the oral occlusion back to normal by just replacing the missing tooth without sacrificing the adjacent teeth. That is called as implantology. Implantology was something which was only available in advanced countries. Implants is something which is the newer treatment plan in dentistry. If you have a missing tooth, we just put a titanium implant into the bone and then we fix a tooth over there. Earlier there was an enigma about implants, but now we have a shoulder replacement, hip replacement, joint replacement, we have cardiac valve replacement. Similarly, we replace a tooth by just putting a small piece of titanium into the bone, and it is a very predictable results. The advantage of dentistry now is because we are very predictable and we are very sure of a success of the treatment. So that is why dentistry has, because of the advances in the materials, equipment and the science in dentistry. Most important in dentistry is you need to have a very good setup, very good equipment, and the state of art equipment is very important, followed by the materials. What you see in the cupboards are the materials. These are all the CE marked materials. The materials used in dentistry varies depending upon the type of material you use. If we use a quality material, CE marked material, ADA with an ADA specification number, ADA is American Dental Association specification. We follow this American Dental Association specification in dentistry, and if we follow that materials which are specified by American Dental Association, they are the material of quality. field of dentistry, what I would like to talk about is geriatric dentistry. Geriatric dentistry is dentistry for aged patients, and geriatric dentistry was earlier for 40 to 60 years of old, but now geriatric dentistry is for patients who are above 60, and since the lifespan has improved, the lifespan has increased, we have to give a lot of importance to geriatric dentistry. Earlier, the protocol of treatment was, in case the patient is old, it is extraction and replacement with a denture. But now, the extraction is the last treatment of choice if we have no other treatment plan, and most of the time it is rehabilitation and getting the tooth back to form and function. Geriatric dentistry is a special field of dentistry where most important is we should understand the psychology of the patient, the limitations of the patient, the medical background of a patient, and then go ahead with the treatment plan. So geriatric dentistry, we have special materials for geriatric dentistry, like we have the special restorative materials, we have the special replacement materials, and we have the special preventive methods, that is to prevent something like root caries. A patient, geriatric patient, would be having a problem of food accumulation in between the teeth, so we need to give them some counseling how to take care of these problems and then manage it by use of ceramic crowns or bridges.